By 2026, peptides have become one of the most popular wellness trends in the world, with nearly $328 million worth of Chinese peptides flooding into the US in just the first 9 months of 2025 alone, an endless list of celebrities like Joe Rogan, the Biebers, and Jennifer Aniston endorsing them, and TikTok doctors spamming social media with videos hyping them up. It's clear that peptides are everywhere you look. But as quickly as they blew up, so did the consequences. From bootleg contaminated vials filled with mystery bacteria flooding the market, to users suffering heavy metal poisoning, severe rashes, and muscle paralysis, to people getting hospitalized, it's pretty clear that these miracle drugs have a pretty dark side to them. So how did peptides go from being a legitimate life-saving medical breakthrough to one of the sketchiest wellness trends of the decade? And more importantly, how in the hell have they gotten so out of control? Well, first off, we need to know what the hell a peptide even is. In simple terms, peptides are short chains of amino acids that act as the body's messengers. They work like tiny little keys designed to open specific cellular locks, telling cells to do certain things like decrease inflammation, increase collagen, regulate hormones, or repair tissue. Fascinating stuff, right? But how did we even figure out any of that existed in the first place? Well, in 1901, a German chemist named Emil Fischer and a French dude named Ernest Fourneau discovered that amino acids are linked together by something called peptide bonds. Emil ended up being credited with coining the term peptide after synthesizing the very first one ever. Now, he didn't invent any actual peptide technology yet, but he gave the scientific world a brand new framework for understanding a huge part of human biology that nobody knew existed before. And 20 years later, scientists would use that exact framework to make one of the most important medical breakthroughs in human history. Fast forward to 1921, and Dr. Frederick Banting and a medical student named Charles Best were on a mission to find a treatment for diabetes. At the time, getting diagnosed with diabetes was essentially a death sentence. The only treatment was an extreme starvation diet, which left patients choosing between dying from diabetes or dying from severe malnutrition. That sounds like complete hell, but thankfully, after some grueling research, the duo successfully isolated an anti-diabetic secretion of the pancreas from dogs. And that secretion turned out to be a peptide, one we know now as insulin, and it became the very first peptide ever isolated and used in medicine. Fast forward 2 years later, and it was being mass-produced globally, albeit at a very slow pace, miraculously turning diabetes from a deadly disease into a manageable one. And from there, the research into peptide technology only got more sound. In 1953, biochemist Vincent de Vignode successfully synthesized oxytocin, another peptide, in a lab, proving that synthetic peptides could faithfully reproduce biological activity in the human body. Then a decade later, chemist R.B. Merrifield invented solid phase peptide synthesis, or SPPS, a chemical synthesis method that made peptide creation way faster, more efficient, and reproducible, transforming peptide production from a slow boutique experiment to a scalable operation that could eventually be automated. Armed with all of these advances now, peptides started branching into all different sorts of clinical use cases. And during the 1980s, researchers discovered one peptide in particular that would later change the entire world: GLP-1, a natural gut hormone that stimulates insulin secretion and delays your stomach from emptying. The problem was, natural GLP-1 degrades in the body in mere minutes, so scientists spent the rest of the 20th century trying to figure out how to stabilize it. And they finally proved successful in 2005 when the FDA approved exenatide, the world's first official GLP-1 drug derived from a peptide found in, I shit you not, the venom of a Gila monster. But while exenatide was an impressive milestone, nobody outside the medical community really gave a shit about it. Peptides were still very much a niche behind-the-scenes science. That is, until one specific GLP-1 came around and changed everything. In 2021, the FDA approved the GLP-1 semaglutide as a treatment for weight loss, which Novo Nordisk quickly started selling under the brand name Wegovy. And almost immediately, Wegovy, along with other brands like Ozempic, blew up overnight to become the most talked about medications in the entire world. And the reason was pretty simple: this shit actually worked. People were dropping serious pounds without any gross dieting or hitting the gym every day. And while the results spoke for themselves, the success of these drugs ended up doing something way more impactful than just shrinking waistlines. It normalized self-injections. Before 2021, the average person would probably never inject medicine themselves unless they had to. But the desire to lose weight was so strong that millions of people powered through their squeamishness. And suddenly, weekly injections in the bathroom mirror were becoming as routine as taking a vitamin. And the fact that everyday people were now comfortable jabbing their stomachs or thighs to drop pounds proved one major thing. Injections were now a totally viable, acceptable form of drug delivery for the masses. But the success of these GLP-1s was so explosive among the masses that the pharmaceutical giants making them, mainly Novo and Eli Lilly, simply couldn't manufacture them fast enough. By 2022, the FDA was forced to place both semaglutide and tirzepatide, a similar peptide found in Mounjaro and Zepbound, on its official drug shortage list. And the way the medical industry handled this shortage ended up cracking open the door for one of the biggest unregulated drug markets in modern history. You see, under federal law, when an FDA-approved drug is officially in shortage, a legal loophole kicks in that allows compounding pharmacies, a special type of pharmacy that custom makes medications to fit the unique needs of an individual patient, to step in and manufacture copycat versions of the drug to meet patient demand. Now, this loophole was originally designed to help everyday patients who couldn't get their meds during temporary supply issues, but in this case, it ended up doing way more than that. Suddenly, an entire secondary economy popped up overnight, with massive telehealth platforms like Hims and Ro legally buying compounded GLP-1s and selling them directly to consumers online. A move that worked so well that they both could afford Super Bowl commercials to hawk their stuff. But while the GLP-1 movement was helping millions of people, there was just one lingering issue: the cost. Name brand GLP-1s go for upwards of $1,000 per month out of pocket, and even compounded versions often went for around $400 to $500. For a lot of people, that price was way too steep. But a certain group of delusional risk takers decided to take matters into their own hands. By bypassing the American medical system entirely, they hunted down off-market peptides at a fraction of the cost. And what they ended up uncovering wouldn't just save them money, it would start an entirely new trend that nobody saw coming, and one that would completely spiral out of control. So those delusional risk takers were Silicon Valley tech workers. And I know that sounds very random at first, but these types of people guinea pigging this shit kinda makes sense. We're not talking about meatheads at the gym or people trying to shave off their fupas for the summer. We're talking about startup founders, CTOs, and engineers, the people building the biggest tech companies in the world. And the thing that ties all of these people together is a borderline obsession with one idea: optimization. In Silicon Valley, there's a whole culture built around squeezing every last drop of performance out of yourself. If there's a way to sleep better, think faster, or live longer, these are the people who are willing to throw money at it without thinking twice. So when they looked at offshore peptides, they didn't see some scary, unregulated drugs. They saw the ultimate life hack. They'd already watched GLP-1s completely transform people's bodies, so the natural next thought was, well, what else can these things do? And the answer they found while trying these peptides was basically everything. They swore peptides could heal old injuries, build muscle, boost energy, sharpen focus, and even boost your horniness. For a crowd that already treats their own body like a software project, that all sounded irresistible. And once a few of them started, it spread through the tech world unbelievably fast. Inside these companies, peptide use would basically trickle down from the top. It'd start with the CEO, then the other executives would pick it up, and before long, it had swept through entire departments. At one health startup, the founders literally kept vials of peptides in the office fridge so employees could inject themselves in their asses on their lunch break. And beyond the Cube farms, San Francisco saw numerous peptide raves being hosted, where DJs played music while chemical diagrams got projected on the walls, and attendees could sit in on workshops learning to mix and inject peptides themselves. But there was a catch with all of these raves and office fridges. Experimenting yourself like this to this degree got really expensive really fast. The official way to get peptides was through high-end wellness clinics and medical spas, and those places charged a fortune. We're talking hundreds to over $1,000 a month. And at the absolute extreme end, a California health club charging an $85,000 membership for access to their custom peptide menu. So naturally, this crowd, a group of people whose entire job is finding inefficiencies and fixing them, looked at those prices and thought there was surely a better way. And there was. They just had to go through China. You see, the vast majority of the world's raw peptides are manufactured in Chinese factories, and tech workers realized they could skip the American system entirely and just order directly from those factories. And doing so was dirt cheap. Instead of hundreds of dollars, a single vial could cost them as little as 10 to 20 bucks. And the way these people found and ordered these Chinese peptides literally sounds like an episode of Black Mirror. These factories would start by running ads on social media showing off cool looking facilities and freezers packed with product. You'd click the ad, get sent to WhatsApp, and start negotiating with the sales rep hiding behind an AI generated profile picture. The scale these places operated at was insane too. One sales rep casually offered a reporter 10,000 vials at $13.50 each. Another, when asked if she could handle 100,000 vials a month, just replied, "No problem, dear friend." And a third offered 1,000,000 vials a month and mentioned she already had American clients buying that much. Now at this point, you're probably wondering how any of this shit is legal at all whatsoever. And the short answer is, it's not. But it all slips through a loophole. The Chinese factories labeled the vials for research purposes only, and as long as nobody snitched on each other, that little technicality kept this whole thing churning. And to get the product past US customs, suppliers would just lie on the shipping label and say their package was something like Philippine face masks. Now you might also be wondering if any of these peptides were safe to inject. And these tech workers were also worrying about the same thing. Because buyers knew the supply chain was sketchy as all get out, a whole industry of independent testing popped up where people would mail their cheap vials to a lab to make sure they weren't about to poison themselves. And a whole bunch of them almost did. On average, nearly a third of Chinese peptides tested by these facilities came back mislabeled, badly dosed, or contaminated. Some vials labeled as one drug contained a completely different one, or no actual peptide at all. Others were tainted with bacteria or heavy metals like lead, and some were filled with cheap sugar, which is a nightmare situation if the person buying it happens to be diabetic. So hearing all of that raises a pretty obvious question. If there's clearly a mountain of money to be made in peptides, why isn't an American pharma company stepping in to make them properly and, more importantly, safe? Well, it mostly comes down to two things: patents and money. A lot of these popular peptides are compounds that already occur naturally in the human body, and under US law, you can't really patent something that nature has already made. So if a pharma company, for example, spent $500 million putting up one of these peptides through proper trials, the moment it got approved, every competitor could hypothetically just sell the same exact thing. So if there's no monopoly, then there's no payday. And no reason to bother. On top of that, the FDA approves drugs that treat specific diseases, and anti-aging or feeling more energetic isn't a disease you can run a clear trial on. To be fair, it's not that Big Pharma hates the science of peptides, they just hate peptides they can't profit from. When they can patent one and point it at a real disease, they'll go all in, which is quite literally what happened with the GLP-1s. But for every Ozempic, there were dozens of other peptides the US medical system simply refused to touch. And that decision left a massive, wide open door of opportunity open. Combine that with the fact that GLP-1s had already gotten the whole country comfortable jabbing themselves with the needle at home, and you had the perfect setup for millions of Americans to see if offshore peptides could help them too. By 2024, peptides had completely broken out of the Silicon Valley bubble and started getting into the hands of everyday Americans. And honestly, you can't really blame them for at least being curious. People were hearing all about these supposed benefits like losing weight, healing old injuries, building muscle, sleeping better, sharper focus, glowing skin, and hornier libidos. So naturally, they wanted in. Two peptides that really resonated with the general public were GHK-Cu, a copper-based peptide that promised to regenerate skin, boost collagen, and erase wrinkles, and TB500, a banned horse racing drug that became the go-to for healing injuries and easing inflammation. But the king of the peptide boom was BPC-157, a healing peptide derived from a protein found in human stomach acid. Users swore it could repair tendon tears in days, fix gut issues, and basically turn you into a superhero when mixed with other shots. Now, of course, none of this shit was approved by the FDA whatsoever. So how in the hell were regular people getting them? Well, they were using that research purposes only loophole loophole I mentioned earlier. Vendors realized that as long as they slapped that tiny little disclaimer on the vial, plus a line saying something like "not for human consumption," they could legally sell these chemicals to literally anyone with a credit card. So suddenly, you didn't need to be a Silicon Valley CEO with a Chinese WhatsApp dealer anymore. You could just hop on Google, type in BPC 157 for sale, and have a vial show up at your doorstep in days. And the widespread adoption of these peptides only got quicker with endorsements from celebrities. Actor Brian Austin Green openly talked about injecting peptides 3 times every morning while competing on Dancing with the Stars, claiming it made him feel years younger. You also had Gwyneth Paltrow, Jennifer Aniston, the Biebers, and Joe Rogan all starting to openly hype them up too, with Joe specifically claiming a certain peptide routine cured his elbow tendonitis in just 2 weeks. And it wasn't just the A-listers promoting them either. An entire ecosystem of influencers, podcasters, and celebrity doctors jumped on the bandwagon, sharing their personal regimens and pushing the idea of peptide stacks, which is just a fancy word for injecting a bunch of different peptides at once for maximum benefit. Andrew Huberman, Peter Attia, Gary Brecka, and Ryan Humiston became some of the biggest voices in the space, basically convincing millions of regular people that peptides were the next big thing in wellness. But the strangest spin-off for all of this hype had to be, and I apologize for even saying this word in the first place, the looks maxing trend. If you have no clue what the fuck I just said, it's basically a subculture of young dudes who are obsessed with mathematically perfecting their physical appearance. And right at the front of this movement was a 20-year-old influencer named Braden Peters, who goes by Clavicular online. He started selling a $39 a month course teaching young guys how to radically alter their faces and bodies. And a huge piece of his advice involved stacking peptides to chase that perfect look. Now, of course, with all of this hype and ensuing demand exploding all at once, somebody had to actually make all of these peptides. And that's where things got even more interesting. Remember those compounding pharmacies I mentioned earlier? You know, the ones that stepped in to make GLP-1s during the shortage? Well, those pharmacies were chomping at the bit to cash in on the peptide trend. You see, compounding pharmacies are mostly regulated by state pharmacy boards instead of the FDA, which practically means there's way less oversight on what they're actually pumping out. So a bunch of entrepreneurs realized they could partner up with these pharmacies, mass produce custom versions of pretty much any peptide they wanted, and sell them straight to consumers online. One former compounding pharmacy worker named Sam Ann confirmed this, flat out saying that the goal inside these labs completely shifted from helping patients to just trying to make a quick buck off people. And directly behind the labs, the telehealth companies were cashing in too. Hims and Row, the same companies running those Super Bowl ads for compounded GLP-1s, started rolling out compounded peptide offerings of their own. And to shell them out, they spent droves on social media ads. Between 2022 and 2024, online ads for unauthorized peptides grew almost 8 times over. And by 2025, the peptide craze saw zero signs of slowing down. Imports of hormone and peptide compounds from China hit 328 million in just the first 9 months of the year, which was basically double what it was the year before. Those TikTok doctors and health influencers were trying more and more absurd new injections, like the Barbie and the date night sex peptides, and getting millions of views promoting them. And like all great detrimental trends, they started showing up in high schools too. So it's clear at this point that peptides had completely taken over American culture. Millions of people, ranging from CEOs to celebrities to teens, were now injecting unregulated, untested chemicals into their bodies on a regular basis. And while the trend kept hitting new highs every single week, something pretty much inevitable was about to start happening. Because when this many people start jabbing themselves with mystery bullshit, it was only a matter of time before the consequences started catching up too. The first glaring problem with all of these unregulated peptides was something doctors had been screaming about from day one: cancer risk. You see, a lot of the most popular peptides on the market work by aggressively kickstarting tissue growth in the formation of new blood vessels. And while that sounds great when you're trying to, say, heal a torn tendon, the body doesn't discriminate toward what kind of tissue it's growing. So if a user happens to have a dormant tumor floating around that they don't know about, which is more common than you think, these peptides can essentially act like a fertilizer, feeding that tumor and accelerating its growth. And the most terrifying part of that is you wouldn't even know this is happening to you for decades. Doctors have said that it could take a decade, and maybe even two, before we actually start seeing the full picture of what these Chinese chemicals could do to people long term. So basically, an entire generation of people right now might be slowly destroying themselves and not even realize it. But that's just the long-term stuff. In the short term, the side effects have become pretty obvious. Users have reported severe full body rashes, blurred vision, random numbness, debilitating anxiety, and depression. One 40-year-old woman who was stacking BPC and GHK reported that it triggered what felt like a second puberty, claiming she suddenly got jacked and had bigger knockers. And if you're abusing growth hormone-specific peptides, you can develop a condition called acromegaly, which permanently and irreversibly enlarges your bones, cartilage, and internal organs. And these aren't just theoretical risks either. People are actively ending up in hospitals from jabbing themselves. Back in July of 2023, two women at an anti-aging festival in Las Vegas got peptide injections at a vendor booth. And within minutes, both of them developed swollen tongues, meteoric heart rates, and severe breathing problems. By the time they got to the ER, one of them had completely lost control of her neck muscles, and the other had to be intubated. And if hearing all of that wasn't bad enough, the Chinese peptides that had mislabels, poor dose amounts, and contamination were, shocker, proven to be shitty for you. Testing on many batches of these foreign vials have uncovered peptides laced with lead and bacterial endotoxin, which are fragments of bacterial cell walls that signal the drugs were made in a filthy environment. And even when Chinese factories try to test their own products, the data is often complete nonsense. One molecular testing expert named Rena Duker actually visited a lab in Beijing and watched the technicians using highly sensitive equipment completely wrong, generating wildly inaccurate data. And when she asked who the data was for, they casually mentioned it was for a local peptide company. But as scary as all of that sounds, it clearly hasn't slowed down the hunger for these shots. Boatloads of people still use them today, so what the hell is going to happen to them in the future? Well, the global peptide market as it stands is valued at over $50 billion, and that number is projected to nearly double in the next decade. The catch though is that almost all of that money is being driven by FDA-approved GLP-1s like Ozempic and Zepbound, and Big Pharma still isn't really interested in funding research for the other wellness peptides everyone's obsessing over, like BPC 157, for the same reasons we already covered. So that means the FDA has to step in and try to regulate the peptide Wild West, something they actually tried before. In 2023, they banned compounding pharmacies from making 14 of the most popular peptides, citing serious safety concerns and cancer risks. And they also went after some of the major distributors pushing this stuff, cracking down on operations and tossing fines left and right. However, as you all already know, this ban did jack shit for stopping unregulated peptides from hitting the market. But now, the FDA might be walking back their initial ban altogether. RFK Jr., the Secretary of Health and Human Services, has been super vocal about believing the FDA is being way too aggressive with peptide bans. He's actually used them himself to heal injuries, and he's basically said the FDA's suppression of peptides needs to end now. And shockingly, they might actually listen and let compounding pharmacies start making these peptides legally again. But whatever ends up happening to the industry, it's clear that peptides have made a significant impact on the lives of millions. And even though they might put you through puberty again, peptide use is showing no signs of slowing down. For another video on a ridiculous drug, click this to hear the story of Galaxy Gas, the viral nitrous oxide brand that caused many deaths.